This is the message that drives physicians to suicide. This is the message that leads to burnout. This is the message that destroys careers and families. And it's bullshit. There's a moment that happens to every medical student, usually somewhere in the third year. You walk into your clinical rotation on day one, you've studied everything, you know the pathophysiology, you know the treatment algorithms, you know the medications, and then your resident looks at you and says something like, "Never make the attending look bad in front of the patient." And you realize, oh, there's a whole other curriculum here. One that nobody wrote down. One that nobody shared with you. Hello, I'm Dr. Felix Becker, and today we're talking about the hidden curriculum of medicine, the unwritten rules, the cultural expectations, the things that determine whether you thrive or get crushed. Because here's the truth, you can ace every exam and still fail medicine if you don't learn these rules. Welcome to In Search of 42. Let me start with a story from my own training. I was a third-year medical student on a surgery rotation. In fact, it was my one day covering one of my classmates on a GYN cancer rotation. It wasn't even my assignment. I was just a body that had to be in the OR that day. Well, it turns out the ORs had electrical problems and the lights wouldn't function, so the case got delayed. A half hour turned into an hour, which ultimately turned into almost 6 hours. I checked back with the OR team about every 20 or 30 minutes to see where things were at with this case, knowing I had to be the first person scrubbed. See, the culture was such that medical students had to be in the OR before any residents or attendings showed up. During my last check-in with the staff, they were just starting to wheel in the operative equipment to open the back table, and I was told we had about 30 minutes before the case would actually start. So I returned in 20 minutes to be on time. But instead, I found the attending, fellow, and resident already scrubbed and about to make the incision. Now, if you have ever been on a GYN oncology case, you know that the patient is in lithotomy position with one person between the legs and one person on either side to get a good look into the pelvis. 3 people were already scrubbed. There was simply no room for me to stand or even hold a retractor. But I was there to learn. So I asked if it was okay for me to instead be above the anesthesia curtain because I could actually see into the pelvis from that vantage point. I received no objection from the team. 2 days later, a formal complaint had been filed by the attending against me. The attending wanted me to repeat my third year of medical school because I wasn't the first person to scrub into the case. Now, that is not what happened, at least not from my point of view, so I did what any normal person taking extreme ownership of their life does. I went to the rotation coordinator to speak with her. She sided with the attending. I told her her job as the rotation coordinator was to take care of the students, not the attending. Another 2 days later, I was pulled into the dean's office to discuss my insubordination. And that's when I learned my first lesson about the hidden curriculum. Your job isn't always to be right. Your job is to understand the hierarchy and navigate it appropriately. Nobody taught me that in the lecture hall. Nobody put that in the syllabus. But it was absolutely essential to surviving my clinical training. Today, we're going to talk about all the things they don't teach you, the unwritten rules of medicine, the cultural expectations, the professional behaviors that everyone expects but nobody explains. Because if you don't learn these rules, you will struggle. You will get negative evaluations. You will be labeled as unprofessional or doesn't fit the culture. And you won't even know why. So let's pull back the curtain. Let's talk about the hidden curriculum. The hidden curriculum is everything you're expected to know and do that isn't explicitly taught. It's the informal socialization process, the cultural norms, the unwritten rules, the this is how we do things here that varies from specialty to specialty, hospital to hospital, attending to attending. The formal curriculum teaches you medicine. The hidden curriculum teaches you how to be a doctor. And here's the problem. The hidden curriculum often contradicts what you're taught in the formal curriculum. You're taught in medical school to practice evidence-based medicine. But the hidden curriculum teaches you to do what the attending prefers, even if it's not evidence-based. You're taught that patient safety comes first. But the hidden curriculum teaches you not to question your senior residents or attendings, even when you think they're making a mistake. You're taught to maintain work-life balance and take care of your mental health. But the hidden curriculum teaches you that complaining about being tired is weakness. You're taught that professionalism means honesty and transparency. But the hidden curriculum teaches you to never admit when you don't know something. This cognitive dissonance is exhausting, and it's one of the major contributors to burnout in medical training. Because you're constantly trying to reconcile what you're told to do with what you're actually expected to do. Let's start with the most important aspect of the hidden curriculum: hierarchy. Medicine is hierarchical, intensely hierarchical, and understanding your place in that hierarchy is essential. Rule number 1, know your place. Medical students are at the bottom. Your job is to learn, observe, and help without getting in the way. You're not there to impress anyone with your knowledge. You are not there to challenge the team's decisions. You are there to be useful, teachable, and invisible when necessary. Interns are one step up. They do the grunt work. They enter orders, they follow up on labs, they stay late to make sure everything is done. They don't have autonomy yet. They execute the plan that the senior resident creates. Senior residents run the team. They make the decisions. They manage the interns. They present to the attending. Fellows are in a weird space. They're more advanced than the residents, but they're still in training. They're learning a subspecialty, and they're trying to transition from being a trainee to being an attending. Attendings are at the top. They have final decision-making authority. What they say goes, even when they're wrong. Here's the hidden rule. You respect the hierarchy even when you disagree, even when you know you're right and your senior is wrong. Now, there is a way to question upward, but it's an art form. And if you don't learn it, you will be labeled as insubordinate. So, how do you question someone above you in the hierarchy? Because sometimes you need to. Sometimes the attending is about to make a mistake. Sometimes the resident missed something critical. And if you stay silent, the patient could be harmed. But if you challenge them directly, especially in front of others, you will pay for it. Here's some of the techniques that I have learned. Step 1, private, not public. Never challenge someone in front of others. Never make them look bad in front of the team or the patient. If you see something concerning during rounds, wait. Pull them aside afterward. Hey, can I ask you a question about that patient? Not, I think you're wrong about that patient. Step 2, ask questions. Don't make statements. Hey, I was wondering about the antibiotic choice for that patient. I saw in the culture data that the organism is resistant to what we're using. Should we consider switching? Not, we're using the wrong antibiotic. Step 3, offer it as something you are learning. Hey, I'm trying to understand the reasoning here because I thought we could do X. Can you help me understand why we're doing Y instead? This gives them an out. They can explain their reasoning. or they can realize they made an error and change course without losing face. Step 4. Know when to escalate. If you've raised a concern privately and it's been dismissed, but you genuinely believe there's a patient safety issue, you have to escalate, but you do it carefully. You go to the next person up the chain, not over someone's head in a vindictive way, but in a I need help understanding this way. Step 5. Pick your battles. Not every disagreement is worth fighting over. If the attending wants to do something differently than you would, but it's not going to harm the patient, let it go. Save your credibility for the moments that really matter. I learned this the hard way. I was a resident and I challenged an attending in front of the entire team during rounds. I was right about the medical issue, but I was wrong about the approach. The attending made the rest of my rotation miserable. Not because I was wrong, but because I made him look bad. And that's the hidden curriculum. Being right doesn't matter if you violate the social contract. So let's talk about performance expectations. What you actually graded on versus what you think you're graded on. You think you're graded on medical knowledge, and you are to some extent, but you're graded much more heavily on intangibles: attitude, work ethic, reliability, likability. Here are some hidden performance rules I want to share with you. Rule number 1, show up early and stay late. If rounds start at 6 a.m., you better be there at 5 a.m. If the team is staying to finish notes, you stay as well, even if you're done with your work, even if you have nothing to do, because leaving early signals that you don't care. Rule number 2, always look busy. Even if you finished everything, even if you're waiting for results, find something to do. Read a chart, look up a patient's condition, talk to a patient. Never sit down and scroll on your phone. Never look like you're not working. Rule number 3, volunteer for everything. Does anyone want to scrub in on this case? Your hand goes up. Who wants to stay and admit this patient? Guess what? You volunteer. Can someone call the family? Yeah, you do it. Enthusiasm matters more than competence in clinical evaluations. Rule number 4, never complain. Not about being tired, not about being hungry, not about missing a personal event. You suck it up. Because complaining makes you look weak. It makes you look like you can't handle it. And in a field that values toughness, that's a death sentence for your reputation. All right, rule number 5, be pleasant to everyone. The nurses, the techs, the janitors, the clerks, because they all talk to your attending. And if they say you're rude or difficult, that goes into your evaluation. I have seen brilliant medical students get poor evaluations because they were dismissive to the nursing staff. I've seen average students get glowing evaluations because everyone liked working with them. Likability is a currency in medicine, and you need to earn it. But let's talk about one of the most toxic aspects of the hidden curriculum: the culture of toughness. Medicine has a long-standing culture that glorifies suffering. Working 30-hour shifts is a badge of honor. Skipping meals is normal. Not sleeping is expected. And if you complain about it, you're weak. I remember being in residency and being told stories about the old days when residents worked 120 hours, when they slept in the call room for an hour and got back to work, or didn't sleep at all, when they operated for 18 hours straight. And the implication was always, you have it easy nowadays with your 80-hour work week restrictions, with your duty hour rules. You're soft. And that culture persists. You're not supposed to call in sick. You're not supposed to take time off. You're not supposed to admit when you're struggling. Because medicine selects for people who can endure suffering. And then it creates a culture that celebrates suffering. During my residency training, it was said that you either round or get rounded on, meaning if you're not sick enough to get admitted to the hospital, you better show up for work. Here's what the hidden curriculum teaches you. Your suffering doesn't matter. Your exhaustion doesn't matter. Your mental health doesn't matter. The patient is all that matters. And if you can't sacrifice yourself completely, you don't belong here. This is the message that drives physicians to suicide. This is the message that leads to burnout. This is the message that destroys careers and families. And it's bullshit. Let me be very clear about this. You cannot take care of patients if you don't take care of yourself. You cannot make good decisions when you're sleep deprived. You cannot be empathetic when you're emotionally depleted. The culture of toughness is not about patient care. It's about hazing. It's about, I suffered, so you should suffer too. And it needs to change. But until it does, you need to know that this is the part of the hidden curriculum, and you need to decide how you're going to navigate it. Now let's talk about something uncomfortable. The hidden curriculum is different depending on who you are. If you're a woman in medicine, especially in surgery, the hidden curriculum includes additional rules. You have to work twice as hard to be seen as equally competent. You have to be assertive, but not aggressive. You have to be confident, but not arrogant. You have to be warm, but not too emotional. You're walking a tightrope that your male colleagues don't have to walk. And I've known several female surgeons being called nurse simply because of their gender. If you're a minority in medicine, the hidden curriculum includes being questioned about whether you're really the doctor, being mistaken for other roles, having to represent your entire race or ethnicity, being told you only got into medical school because of affirmative action, having to code switch to fit into the dominant culture. If you're LGBTQ plus in medicine, the hidden curriculum includes deciding whether to be out, navigating conversations about your personal life, dealing with patients or colleagues who have biases, finding mentors who understand your experience. The hidden curriculum assumes a default: straight, white, male, able-bodied, neurotypical. And if you don't fit that default, you're navigating additional challenges that aren't acknowledged. You're expected to just figure it out, to not make waves, to fit in. Now, I'm a straight white male physician. The system was designed for me. And even I struggled with the hidden curriculum. I can only imagine how much harder it is for people who don't have that privilege. So if you're from an underrepresented group, know this. The struggles you're experiencing are real. They're not in your head. The system is harder for you, and that's not fair. But you're not alone. Find mentors who get it. Find community. Find people who have walked this path before you, because you will need them. Let's talk about the emotional labor, because there is a whole hidden curriculum around emotions in medicine. Don't show emotion, especially not vulnerability, especially not sadness or fear. You can show confidence, you can show determination, but you can't show that you're affected by what you're seeing. When a patient dies, you move on to the next patient. When you give bad news to a family, you stay composed. When you see something traumatic, you don't talk about it. You compartmentalize, you stuff it down, you keep working, and over time, this takes a toll. Because you are human, and humans have emotions. But the hidden curriculum teaches you that emotions are weakness, that crying is unprofessional, that admitting you're affected by a patient's death means you're not cut out for this. I have broken down in private because I was not allowed to break down in public. I have seen physicians develop substance abuse problems because they never learned to process their emotions. I've done it myself. I've gone home after a terrible shift and numbed myself with alcohol because I didn't have any other coping mechanism. The hidden curriculum doesn't teach you how to process trauma. It teaches you to ignore it, and that's dangerous. Here's what I wish someone had told me. It is okay to be affected by what you see. It is okay to grieve for your patients. It is okay to feel sadness, fear, anger, helplessness. These emotions don't make you weak. They make you human. And being human is what makes you a good doctor. You just have to find healthy ways to process these emotions. Therapy, peer support, debriefing, exercise, creative outlets, whatever works for you. Because if you just stuff it down, it will destroy you. And it's okay to be emotional in front of and together with patients because it shows you care. You have my permission to be human. Let's talk about mistakes because the hidden curriculum around mistakes is particularly problematic. The formal curriculum says mistakes are learning opportunities. The hidden curriculum says don't admit mistakes. Medical students are taught about the importance of transparency, of reporting errors, of learning from mistakes. But in practice, admitting a mistake can end your career. You make an error, and suddenly you're the person who can't be trusted. You miss a diagnosis, and you're labeled as incompetent. You have a bad outcome, and it follows you forever. So the hidden curriculum teaches you to cover your ass, to document carefully in a way that protects you, to never admit fault, to always have justification for your decisions. And this is terrible for patient safety. Because if people are afraid to admit mistakes, mistakes don't get reported. And if mistakes don't get reported, we can't learn from them. We can't fix the system that led to the mistake. Now, I have made mistakes that have harmed patients. I've made errors in judgment. I've missed diagnoses. I've had surgical complications. And every single time, I had to navigate this tension. Do I report this transparently and risk my reputation? Or do I minimize it and protect myself? The culture is slowly changing. Some institutions are getting better about creating a just culture when people can report errors without fear. But we're not there yet. And in the meantime, you need to know that this is part of the hidden curriculum. Mistakes happen. You will make them. And when you do, you need to balance honesty with self-preservation, which is a terrible position to be in. But it's the reality. All right, let's talk about something else medical school barely mentions: the business of medicine and the politics of medicine. The hidden curriculum includes understanding that medicine is a business. Patients are customers. Revenue matters. Efficiency matters. Productivity metrics matter. You will be evaluated on RVUs, relative value units, essentially how much business or money you generate for the system. You will be evaluated on patient satisfaction scores. You will be evaluated on how many patients you see per hour. And none of this is about quality of care. It's about money. But nobody says that out loud. The hidden curriculum also includes hospital politics, understanding which attendings have power, understanding which committees matter, understanding how decisions get made, understanding who to align yourself with and who to avoid. This is especially important if you want to advance in academic medicine. Getting promoted isn't just about your clinical skills or your research. It's about playing the political game, going to the right conferences, serving on the right committees, publishing with the right people, being visible to the right administrators. Nobody teaches you this. You're supposed to just figure it out. You're expected to know all this. And if you don't figure it out, you'll wonder why your career isn't advancing while less competent colleagues are getting promoted. I didn't understand this early in my career. I thought doing good work was enough. It's not. You have to do good work and navigate the politics, because that's the hidden curriculum. The hidden curriculum is different in every specialty. In surgery, the hidden curriculum is about toughness and hierarchy. You don't question the attending in the OR. You don't sit down during long cases. You don't admit when you're tired. You operate even when you're sick. In internal medicine, the hidden curriculum is about intellectual prowess. You know the obscure diagnoses. You read the latest literature. You can discuss the pathophysiology in detail. In pediatrics, the hidden curriculum is about patience and warmth. You relate well to kids and families. You don't get frustrated when parents question you. You project calm even in emergencies. In psychiatry, the hidden curriculum is about boundaries and self-awareness. You maintain professional distance. You reflect on your own reactions. You don't judge patients. In emergency medicine, the hidden curriculum is about efficiency and decisiveness. You make quick decisions with incomplete information. You move fast. You don't dwell on individual patients. Every specialty has its own culture, its own unwritten rules, its own expectations. And you have to learn them, usually by making mistakes and getting corrected. This is why rotations in medical school are so important, not just for learning medicine, but for learning the culture of each specialty. Because you need to find a culture that fits you, especially where the hidden curriculum aligns with who you are. Because if you choose a specialty where you're constantly fighting against the culture, you will be miserable. So, how do you navigate the hidden curriculum successfully? Find mentors, not just academic mentors, but mentors who would tell you the unwritten rules, who will warn you about the political landmines, who will teach you how to navigate the culture. Those mentors are invaluable. Observe. Watch the successful residents. Watch how you interact with attendings. Watch how they handle difficult situations. Watch how they navigate the hierarchy. Learn from them. And then build relationships with your co-residents, with the nursing staff, with the attendings, with the administrative staff. Relationships are currency in medicine, and they will protect you when things go wrong. Know how to choose your battles. Not every hill is worth dying on. Not every injustice is worth fighting for. Not every instance of the hidden curriculum is worth challenging. Save your energy for the things that really matter. And take care of yourself. The hidden curriculum will tell you to sacrifice yourself. Ignore that message. Set boundaries. Get sleep. Seek help when you need it. Because you cannot navigate the system if you're completely depleted. Find your people. Find the people who get it, who share your values, who will support you when the culture is crushing you. You cannot do this alone, and you shouldn't have to. All right, let's connect all this to burnout, because the hidden curriculum is one of the primary drivers of physician burnout. When you're constantly navigating unwritten rules, when you're pretending to be okay when you're not, when you're sacrificing yourself to meet cultural expectations, when you're staying silent about things that bother you, when you're conforming to a culture that doesn't align with your values, you burn out. The hidden curriculum creates moral injury. Moral injury is what happens when you're forced to act in ways that violate your values, when you're told to prioritize productivity over patient care, when you're told to ignore your exhaustion and keep working, when you're told to not question decisions you think are wrong, when you're told to fit into a culture that doesn't reflect who you are. That's moral injury. That's moral injury. And it's one of the most significant causes of burnout in medicine. So if you're feeling burned out, ask yourself, how much of my burnout is from the hidden curriculum? How much is from trying to conform to expectations that don't align with who I am? How much is from moral injury? Because if that's the case, the solution isn't self-care. The solution is challenging the culture, either by changing your environment, or by setting boundaries, or by leaving altogether. You cannot fix systemic problems with individual solutions, and the hidden curriculum is a systemic problem. Now, can the hidden curriculum change? Yes, but it's slow. Culture change in medicine is glacial because the people who hold power benefited from the old system. They suffered through it, and they don't want to make it easier for the next generation. But change is happening. work hour restrictions for residents, more focus on wellness, more conversations about burnout, more diversity and inclusion initiatives, more emphasis on psychological safety. It's not enough yet, but it is something. And you can be a part of that change by being the attending who teaches the hidden curriculum explicitly, by being the mentor who tells students the unwritten rules, by being the person who challenges toxic culture, by being the leader who creates a psychologically safe environment, by being the physician who models healthy boundaries. You can't change the entire system, but you can change your little corner of it, and that matters. Here's my advice for navigating the hidden curriculum. First, learn it. You can't navigate what you don't understand. Pay attention, ask questions, find mentors, learn the unwritten rules. Second, decide which rules you'll follow and which you'll challenge. Not all of the hidden curriculum is bad. Some of it is genuinely about professionalism and patient care, but some of it is toxic. You need to be able to discern the differences, and you need to decide where your boundaries are. Third, find your people. The people who share your values, the people who are also struggling with the culture, the people who will support you. You need a community. Fourth, take care of yourself. Set boundaries even when the culture tells you not to. Get help when you need it. Don't sacrifice your mental health for a culture that doesn't care about you. Fifth, be the change. When you have power, use it to change the culture. Teach the hidden curriculum explicitly. Create psychological safety. Model healthy behavior. Challenge toxic norms. Because the next generation deserves better than we got. The hidden curriculum is real. It's powerful. And it shapes your experience in medicine more than anything in the formal curriculum. But it doesn't have to define you. You can navigate it successfully. You can maintain your integrity while playing the game. You can challenge it while protecting yourself. And you can be a part of challenging it for the better. The hidden curriculum will tell you who you're supposed to be, but you get to decide who you actually are. This is In Search of 42. I'm Dr. Felix Becker. And remember, you own your career, all of it, even the parts they don't write down. If this episode resonated with you, hit that like button and subscribe, and leave a comment about your experience with the hidden curriculum. What unwritten rules have you encountered? What surprised you about the culture of medicine? What do you wish someone had told you? And let me know what you want me to cover next, and I'll see you in the next episode.